So the best that I was offered was 1080p at 24 frames a second, I think. So not really good enough, certainly not good enough for 2021. So I've been making various modifications to this microscope to allow for a high enough resolution and a good enough frame rate. And believe it or not, the frame rate is actually very, very important to the quality of the image, and the higher the frame rate, the better. So now this doesn't mean that I've ditched the endoscope. It's just that this is a project that's been taking up a considerable amount of time. And so, a few more of these experimental videos with the microscope will be dropping into the channel fairly soon. I hope you enjoy them. But we've also got some very, very interesting cases with the endoscope coming up as well, so stay tuned for that. We've got some very, very tough wax here, which is lodged in the ear canal. And I'm just trying to tease it out now that it's been oiled. And it will come eventually. I'm almost certain that there will be various people watching, maybe healthcare professionals, doctors, nurses, audiologists, that are trained to use microscopes or surgical glasses, what we call loupes. So you're probably wondering why I'm not using a speculum, which is like a little funnel that you would put into the ear to keep the ear canal straight and you can suction away. And the reason I'm not using a speculum is because I think they're a bit of a faff. So if I can get good visualization of the debris that I want to remove, I very rarely use it. And here we go. Here's the plug of wax right there, fairly dark and oxidized. And we'll get a shot of the eardrum with the endoscope. So I'll go back in and capture that. So we'll switch back to the endoscope now. Ear canals looking a little red, eardrums looking a little inflamed, but not surprising given how large the plug was. So this is the patient's other ear now. So we've got kind of a medley here, a bit of a compilation, shall we say. And this will also need olive oil as well. But yes, I have speculums in the clinic, obviously, but if I can avoid using one, I avoid it because I think it just complicates everything. So a little bit more olive oil in here. And now we'll go in. The thing that I really like about this microscope is it just gives you perspective, I suppose. So when you go in with the endoscope, obviously you're very close to everything and it's a very zoomed in image. But I quite like seeing the entire canal and just sort of, it's much easier to get your bearings, I suppose. Very, very good if you need to use manual tools. So you can see exactly where you're putting the tool, you can slide it round. And obviously you can do that with the endoscope as well, but sometimes you lose a little bit of perspective as to, where you are in the canal and how big things look. So I'm just kind of wiggling this wax around just to kind of unadhere it from the ear canal. And it should come out in one foul swoop here. There we go. So this plug isn't as large as the other one, but still a fairly significant blockage in the patient's ear. We're going to go back in with the endoscope and check it. And the eardrum